A couple of weeks ago, the United States Supreme Court rendered its verdict when it comes to the Affordable Care Act, better known as Obamacare or the health care law here in the United States. Now, I know this is a federal piece of legislation, but it's one of these pieces of legislation that will affect every man, woman, and child that lives in this country, including all of us right here in the Lakes area. It was a 5-4 decision to uphold the individual mandate, which was considered the most controversial piece of that legislation. Some people say it was the linchpin that held the whole thing together, both from a financial standpoint and from a practicality standpoint. But now the law has been upheld. And politically, it's a big firestorm. The Republicans, of course, are going to use this as ammunition to try to knock out current sitting president Barack Obama. And the president's going to have to make his stance on that health care law, especially since, in a twist with the Supreme Court ruling, the Supreme Court ruled, in fact, the law is a tax, and it is not just a fee in the Consumer Clause or the clause that talks about commerce, the Commerce Clause, as many had argued it would be. But it's also worth noting that the Affordable Care Act actually doesn't cover everybody. There are still people exempt from it. Most notably, in this area, Native Americans are exempt from the Affordable Care Act. Now, some people might ask why this is, and frankly, there's a lot of federal programs already that pay for a lot of Native American care. Most people that are members of the White Earth Nation will tell you they're able to go up to the White Earth hospitals and clinics and be treated easily up there without it costing them anything. So they're exempt. Also, anybody that doesn't file a tax return, in other words, those that are so poor and indigent that they do not make enough money to file a tax return, will also not be required to pay the individual mandate or even get compensation through the insurance exchange programs, which is awfully complicated to even break down. So knowing that, doesn't that mean then some of the poorest in this country that drove up the cost of health care in the first place still won't be covered under health care? What the individual mandate in the health care law really did was to make sure that people, well, frankly, in my age group, 20 to 30 years old, are forced to buy health insurance, but many of them chose not to because they didn't want to pay the extra money and felt that they were healthy enough and decided to take the gamble. This piece of legislation has forever, in my opinion, changed the balance between the people and the federal government. Because what it does now is it says the government can make taxes to force every American to have some kind of behavior, even if there are certain people in the country that are exempt from the law. The healthcare law, I've compared it to a classic car. There's a great framework in place when you talk about things like not denying people coverage for pre-existing conditions, leaving kids on longer on their health insurance with their parents, etc., etc. These are all fantastic things with it. But there are a lot of payment things that people are concerned about too. There's 15 different taxes that come with this law. If you're a tanner, you've already noticed the 10% increase in paying for, well, when you go tanning. Also, there's a lot of taxes on people that make certain income levels, those of $250,000, $500, and $1 million. Although that's the 1% in our country, they actually end up paying a little bit more. And lots of other different fees that are hit into it. It's going to be a while before we truly understand how the healthcare law works. Minnesota has expanded its Medicaid program. So when you heard them talk about that on the news about Medicaid, we're already doing these exchanges. Exactly how the exchanges work and whether or not it will actually drive down the cost of healthcare is going to take a lot of time. And we won't know for a couple years, unfortunately, if this is a good law or a bad law. But I do know it's going to be a key point in the next election, and we're all going to have to decide whether or not we like the new healthcare system that's being pushed on us in our country.